We're continuing to dig into the impact the closure of the Cape Fear Memorial Bridge will have on drivers and the plans in place to cross the bridge during emergencies. WWAY's Tanner Blue joins us now live in the studio. Tanner, what are some of the options for those who need to cross the Cape Fear River?
Hannah, whether it's for work or if it's for a health emergency, there are some options for those who need them. Beginning of 2024 will not just mark a new year, it will mark new challenges for commuters in the Cape Fear. The Cape Fear Memorial Bridge is scheduled to undergo construction in January. The bridge will be closed at first, followed by entire lanes shut down. Abby Lorenzo, the deputy director of the Wilmington Urban Area Metropolitan Planning Organization, says they have some ideas for businesses and employees who could be affected.
Teleworking, if that is an option. Alternative work schedules, so instead of working 8 to 5, perhaps employees' schedules can be shifted to move some of those trips outside of that typical peak hour.
Lorenzo says other options are geared towards supporting the public and those who might not work or commute.
If you can ride a bike, if you can use transit, if you can travel outside of the normal time that you would typically make this trip, that is all helping to ease congestion.
One thing you can't plan are medical emergencies. Getting treatment quickly could mean the difference between life and death. Novant Health plans to utilize their Airlink medical helicopters if needed.
We currently have 2 helicopters that are staged within the catchment area for citizens that would be commuting to and from. Both those assets will be used to move time-sensitive patients such as cardiac patients, stroke patients, patients experiencing traumatic events.
Kevin Hodge, the chief transport nurse with Airlink, says this can be quicker than on the road.
From lifting from this helipad that we're standing on, distance traveled by ground would probably take roughly 45 to 50 minutes. We can get there in 10 minutes.
The WMPO and Novant Health both realize that these options might not work for everyone, but they will try to help as many people as possible.